talk about all things regarding program enhancements. And so there's specific other topics we'll be talking about in the future as well. All right, I think we have a sweet little group here waiting till 3 after, as is usual. It was a high-tech day today too, so I've done a lot of talking all day. High-tech is the Sarah talks for a few hours thing usually, or at least tries to steward and facilitate conversation for a while. All right, I think let's go. We might be able again to end early, who knows? We'll see what happens. Next slide. Again, thanks for joining. I think I see all kinds of constant friends on the call here today. This is the beginning, as I mentioned, of our program enhancements focused terminology meeting. We do new terminology development for new domains at the alternate week, but this is the meeting we're leaning into to really focus conversations on program enhancements as we work to enhance and evolve our standards. Thanks for joining. We start muted. There's not a lot of you, so the large number of attendees is not accurate. The calls are recorded, and we encourage you to participate. Send your chats to everybody. Next slide. This is the common antitrust practices slide. Gravity project participants have the responsibility to comply fully with federal and state antitrust laws. Many of you all are accustomed to this meeting, and this is part of our responsibility as a being HL7 Fire Accelerator and a standards development entity. And so just noting this. Next slide. There's a lot of me talking, but hopefully I will see some of our program classifications. Me is on here. We just met this morning, so some of them might be out doing other things, but it's my job to relay their knowledge. I'm going to give a coding for food update. We gave one last week as well, but this is the place that we will be doing our coding for food work when we bring it to the public after our SME meetings kick off, doing some pre-work. I'm going to give an update on the program classification work, and then we'll do community homework and next steps. For anyone who's been involved in terminology for some time, this meeting will take a different cadence and pattern than the other meeting, right? So we have our now very formal terminology curation process, and some of you on the call helped review our process document that we're drafting to share that process with the world. But that very formal 6-month process that we do for new domain terminology is the week just behind us and ahead of us. This meeting is a little bit more discovery, and it's very much rooted in new things. And so our patterns might not be the same as that other meeting, but that's totally okay. Our homework is different. Our homework today is just going to be thinking, but we are really excited to have a place to do this work. Next slide. Hi, Linda. I just saw Linda Hyde's name, our friend Linda. Next slide. Sorry to call you out. Linda was such a solid member of the terminology team for so many years. It's always nice to see her. There's a little bit more time to update your email preferences. So if you've not already done so, please do so. The terminology members are the largest members in the current Gravity email stream. And it's because of how topical our conversations are. So we get a flood of food insecurity folks, a flood of transportation people, a flood of language barriers folks who don't necessarily always want to stay up with the cadence of meetings. But we really want to make sure that everyone has an opportunity to participate. And so please update your email preferences if you have not. Next slide. Gravity Tech, just brief announcements, nothing too groundbreaking except for implementation work streams not happening this month. The Gravity technical meeting meets Wednesdays 1 to 2. And then the implementation work stream is still the last Thursday of the month. Just of note, we just came off this afternoon. You know, we've been talking a lot about the New York 1115 waiver. We just came off the first kickoff of the waiver today, the New York waiver, and so we'll be talking more about that in implementation work stream as we go forward. Next slide. Any questions on the announcements, roadmap stuff? Okay. Next slide. Hopefully it feels like a light meeting, and I didn't craft it this way because I'm sick. It just happens to be Janice. Hi. Yep.
Hi, how are you today? I'm curious about the New York. I'm sorry, I'm double tasking here. Is it for the state of New York or the Bronx or
The whole state. So the whole state is
okay,
aligning their implementation of their 1115 waiver with gravity terminology and gravity standards. It's
great. So a Medicaid transformation grant,
Yeah,
right?
yes, yes, and it's the first state to do that by design. I mean, the California Data Exchange framework has some references to gravity data elements, but the New York waiver is visionary, and it's actually able to kind of build off from some of the learnings from prior waivers because gravity terminology is so interwoven with so many different regulations now. It's wise to get early adoption, and New York leaned into that task, right? So it's very exciting.
Yeah, it is. I just want to add that New York is very forward thinking. I was in
Yeah,
New York City last year for a social social artist social prescribing, right? Art
yeah,
social
love
prescribing
it. Yes,
conference at Columbia.
love it.
And where I stayed right outside my window was they had a mobile health van for individuals
Love it.
who
Yeah.
could have health. And then they had the next distro. I don't know if you know them. They're people
Mhm.
that service and yeah. And they were driving vans around and doing harm reduction work. Like I was like really impressed by the extent that they're working in this multi-hospital. It's not like just one hospital. Of course, that's just in the city, right? But this is wonderful at a state level to have the 115 waiver pick it up. Yeah, it's great. Thank you.
You're welcome. They've been doing really innovative things for a very long time, and I can testify, like from the other side of the lake, like early DSRIP, regulations, doing really innovative social care payment models, and they've definitely been a leader in the field, and the waiver is no different. And we'll bring all those findings and learnings to the implementation work stream for all of you. Um, We're going to quickly go through the overview slides. We just try to keep them here for the first few meetings. So we are a collaborative initiative with the goal to develop consensus-driven data standards to support the collection, use, and exchange of data to address the social determinants of health. And we are you. All of you are us. So happy Gravity Project Ness. Next slide. Just a reminder of our members. Very, very grateful for all of our members and sponsors. We couldn't do what we do without all of you. And again, I always try to make a nod to anyone who's new, that noting that part of our membership model includes designated members, including critical patient voices and critical community-based organization voices, because we recognize they're critical for the work. So that's part of the uniqueness of our governance structure within HL7. Next slide. I think most of us are recognized and known here, but this is the timeline. So we've been around since 2019 with our first domains, and now in 2024, we were just released an STU 2.1, right? So we have our STU 2.1, and we're working on our STU 3 update for our IG, and how many is it? 21 domains now? 20 domains, Sarah Bahal? I don't remember. It's a lot. But we have now honed that part of our work. And you can see down here on July this is part of why we're here, because as we continue to develop domains, and we've really honored to become a place of reference where that work happens nationally, we definitely are leaning into the things that our enhancements are new, and that's what this meeting is all about. Hi, Janice. Yes.
Is the HL7 Flyer the Connectathon
Oh, that's
or
just, I mean, that's because we try to, you can see that aligns with all of the different updates of the implementation guide. Right, so
okay,
we are a fire accelerator project, so we do the terminology development under the accelerator project designation, and we also do our exchange standard, which is that social terms of health clinical care implementation guide. So you can see that underneath here, there's policy things like being included in the United States core data for interoperability, but there's also IG and fire things, which is each publication. Every time you see that logo, it's with a publication of the fire implementation guide.
nice. I know you have to have designated okay to do that. I was
I
just
know.
curious how it played along because yeah, we've done connectathons all the way through, but now I understand it's a great place to put them. Thank
Yeah, of course. Any other questions? All right, next slide. We're gonna have to get another slide. There's too much to fit. You all are aware of this. So part of why we are here is because we have our new domain work on the top, right? utility and security and spraying and language barriers and incarceration status. That was last week. And then next week, every other week, the new domain development through our terminology curation and terminology development process. And then we're also creating this meeting for our enhancements work. And coding for food is going to be brought into this meeting because it really is an enhancement of food insecurity. We'll talk more about that in a minute. And it very closely aligns with our program enhancement initiatives because it is a enhancement in the realm of programs and interventions. And it's still a dotted line, even though we're working on it. There's more to come on that because we're just awaiting the final contracting, and that will finish up very, very shortly. Next slide. Oh, sorry, there's a lot more on that side too. But there's the STU ballots, right? Our focus for the fall is, aligning our STUH clinical care implementation guide with US Core 6.1, which is a necessary update that we've been working on, we've been planning for a long time. And then also just trying to look forward into the future to think about priority new use cases, right? Still figuring out payment and reporting and outcomes and whether there's work there. And then also just our governance committees, which again, some of you were part of, trying to figure out what new use cases and resources we want to lean into within the IT. Next slide. Our data principles couldn't do what we do without them. So just noting that as a social justice minded and health equity aimed initiative, we have principles that guide our work. Again, I was in high tech all morning. I helped co-chair that committee, and it's always lovely to see so many of the elements that we address here woven into things like the high tech annual report to ONC, or some of the initiatives that we're working on in health equity by design over at the new ASTP, right? So it used to be ONC and now it's ASTP ONC. But these have grounded our work for some time, and so we just reference them in all we do. Next slide. Any questions on that? That's just the overview, trying to get through it because many of you are familiar but don't want to neglect anybody I don't see. Okay, next slide. Next slide. Okay, this is the work we do. So this is our terminology curation process. Again, you heard me talk about it. You all are critical members and parts of that. This is the very formal work that happens usually, and it's it's all really focused on new domain work. We are adapting it slightly for some of this enhancement work because it's not as linear. We run a tight ship over new domain work in order to finish what we have to do in order to align with submission cycles with the terminology organizations. But when we do this enhancement work, we're a little bit looser. Next slide. And then this is the output of what we do in our terminology development work. Next slide. Oh, and there's some comments here. Do I see comments? Oh, it's Sarah. Okay, there we go. Sarah Bahal. Okay, so I just want to remind everybody, you were here. If you were here last week, you heard this, but here I'm going to say it again here because it's really important. This is hot off the press and breaking. We are having weekly meetings now, and one meeting is going to focus on that the normative new domain terminology development for language barriers and incarceration status. For those of you who were here last week, we have brilliant subject matter experts across both domains, and actually are acquiring new SMEs all the time, right? We have some new subject matter experts coming in the wings for language barriers, and I'm grateful for those. And then here we'll do the terminology enhancement works, the coding for food work, and program classification and program documentation. Next slide. And then just want to update, incoming coding for food will join us here. Our lovely friends, Kirsten and Katie, and the amazing subject matter experts. So SMEs for each of the 3 different concepts: medically tailored meals, medically tailored groceries, and produce prescriptions. There's like 10 SMEs each, at least, for the different work groups, because it's a truly national initiative that built off of like 2 years, 3 years of work. Again, I mean, even 5. We started talking about HCPCS codes to support food medicine in 2019. So that will come into this group where we talk about programs. So we'll be doing language barriers and incarceration last week, in the last week, every other week cycle, and coding for food and program classification and program enhancements here. Next slide. And there's lots of materials on the compliments. Yes, Janice. Hi.
Just full of questions today.
I love it.
I'm taking Lucy's job.
We love questions. You know me.
Yeah, on the last slide, I'm
Okay.
just curious where it has medically tailored groceries. Like I
Mm.
was talking to a friend recently. I had offerings for plant-based share like during COVID that were delivered to my home. It was
Yeah.
wonderful, right? All, from farm to door.
Yeah.
And but I couldn't cut the gourds and everything. So I have advanced arthritis and
Oh,
you know,
yeah.
and so now they've done a little bit better at tailoring. I'm not receiving it anymore, but they recognize that. But I wondered if, that's going to be taken into account with medically tailored, I'm sure, with people's disabilities, right? Like,
Yeah. Yeah.
yeah.
And I think the medically tailored element of medically tailored groceries is like TBD because um, the medically tailored meals is very, very clear. There is a national standardized definition. The
Right.
Food is Medicine Coalition, dear friends of mine, Alyssa Wassong, who used to be at God's Love We Deliver, which is a New York medically tailored meals organization in New York City. She's the lead over there at FEMIC. So there's really, really clear consensus on the medically tailoredness of MTM because like a registered dietitian or nutritionist consults on the suite of food for a particular individual based on their diagnoses. Medically tailored in groceries is something we're going to be talking about when we do the SME groups. And prescriptions are very, very clear. Again, we use those all
Right.
over the country. Yeah, but yeah, so we'll talk more about how medically tailored fits with groceries, but that's kind of the thought, right? And
Yeah.
there's been so much research regarding this. Like there's like one of my favorite researchers, Hilary Seligman, did research just like 10 years ago on the benefit of delivering, diabetes sensitive food boxes to individuals with diabetes at food shelves, and how it was very, very low effort from a food shelf and like food pantry perspective, but had significant benefits and outcomes of A1C. So
Hmm.
significant,
Is
significant.
that UW, University of Washington?
Hilary Seligman, she
No.
is, no, I think she's UCSF, right? I think she's along there with Laura, last I knew.
Yeah,
Um,
huh, that's great anyway, because it is really important. Some people want to be autonomous, and then, it's just as many people want tailored meals, but
yeah.
to have both options is great. Thank you.
You're welcome. And you're gonna have to suffer me because remember at heart, when I was anything, I was a food insecurity specialist, and that's how I started with Gravity, was the SME for food insecurity. So I care deeply and passionately
All
about.
right.
I know I was a former farmer food insecurity interventionist specialist before I was any of this.
I've been a frack follower for over decades.
Oh, love
Anybody
frack.
that knows,
Right,
yeah,
we're nerding out here. Excuse
yeah,
us.
frack.
Yeah, yeah. The friends at Frack are some of my dearest friends. Okay, carry on. So that will all be coming in here, and those of you who will have to suffer, how excited I am to see, because like when you look across the work groups, some of my dearest friends are there, so it's going to be fun. Next slide. All right, so this is the cycle and sequence for the program enhancements work. Again, we're awaiting the final contracting to formally kick off, but I think we can expect that program enhancements is going to include coding for food in a little bit of a delay anyway, because probably medically tailored meals is going to be quite easy to bring some concepts to kick around with all of you. But some of the other ones might require a little bit of work. But we started on purpose with the three things that had the most consistent definition, because we're going to get our feet wet. And then in the spring, we're going to do things that are a little bit trickier in this next cycle of coding for food. But this is the every other week cycle that's focusing on terminology intervention enhancements. Next slide. And then we have our language barriers and incarceration concepts. And my apologies to anybody who was here last week. I just want to make sure that everyone knows, because it's a sea change. Note that the language barriers and incarceration sequence follows directly our standard terminology curation process with the concept identification, end-to-end review, and consensus vote. And again, all of that's built to align with the terminology submissions and the cycles, especially ICD, because usually we try to finish our consensus vote prior to the deadline for submitting ICD-10-CM for the March meeting. Yes. Alexandra Ashbrook at FRAC is one of my dearest friends. All right. Any other questions on this? Love it. Next slide. Okay, and then we will have masters uploaded for language barriers and coding for food and history of incarceration status. But program classification is proving to be a little bit more conceptual. So we will not have a master this week, and I will soon show you why. It's not because it's not as spreadsheet friendly, I would say at this time, because it's really much more conceptual and thinking. So we're going to share with you some decisions we've made, and then your homework will be just to think about them. Next slide. All right, next slide. Just a reminder of the 3 areas that we're working on in program enhancements. We're just focusing on classification today because it was a busy week. We still have some things to address in program documentation, though. So we are doing our end-to-end review of program term analysis to make sure that our list is complete. I want to note that just working on program classification is showing the Gravity team when there's gaps, and we're going to be talking about that shortly. And we are going to be continuing to talk about how standards for how we document programs. When we met last time, which was a bit ago because of the last meeting, I think it was about 3 weeks ago, we agreed that as a good start, we would lean into concepts and terms to identify the program and not overly pre-coordinate terms to document enrollment. But we heard on the New York call, and we hear all the time, that establishing standards for understanding the difference between eligible for and enrolled in is really critical. So that's a work in progress, like how we document that someone has received something and someone's enrolled in a program. That is part of our work this fall. We're going to be specifically talking about program classification today, though. Next slide. Do those 3 areas make sense? So we have like auditing all of our programs, right? Our big list. We have a big list. And then we have considering a structure, an open classification to organize our programs within, a logical and helpful hierarchy for the purposes of navigation and connection. And then we have conversations on how we document that a person is enrolled in something or has received something, because that's obviously the final goal, right? And when you think about outcomes analysis, like if I were a health system trying to figure out whether the things that I've done are helpful, what I'm really analyzing is that what is the outcome differential? Just like I said, Janice, like what's the difference between those entities that have received X service or enrolled in X program versus those who are not? Right. And so terminology to support that is something that we need to figure out. We have all of our intervention framework concepts, but we don't have a ton of those provision of or enrolled in concepts. We have very few, but that's more to come in the fall. Next slide. And this is the first meeting of this type, so just recognize that I said this was going to be in July. It's already August and I haven't sent it out yet, but so we're going to be sending out this program term analysis list, the master list of programs, and having entities identify programs that are critical for reimbursement. More to come on that. I have the ask. I just need to bring it to the OC operating committee, and then we'll go forward from there. Next slide. And I already went into this. This is the program classification, and then we can go into the next slide. You all have seen these. And then next slide is the program documentation. Again, we talked a little bit about it last time. We're going to lean into program classification today. And we already kind of settled on the fact that we're wary of overly pre-coordinating. Next slide. All right. I'm now going to go into, it is 4:25, and I'm finally getting to the meat of the call, but there's lots of updates, and thanks for your patience. And I'm going to also thanks for being patient with me because I am a little sick today. All right, so we're going to go into, last time we met on program classification, we only presented the top level like sorting concepts. So we're going to be on a little journey today. I tried to figure out the best way to help you all understand the work that's going on in this meetings. And so I realized there were similarities to the way we develop concepts. So we're going to talk about them today. And I don't know if I see any of the, I see Matt. Matt's a designated friend from the SME world. Hi, Matt. Next slide. We had a SME meeting again this morning. So again, like I mentioned, it's a little bit different, right? So we're convening. It's not as a fast a clip, right? We have a very fast clip over in the terminology curation and new domain development about when we bring things to you. This is so new what we're doing and knitting together different classifications that We're trying to make sure that we come to full agreement on the knitting together before we bring it, but I wanted to make sure you all could see some of the thoughts we're having. And then there's no, what we do next is a little bit more simple. We're going to be publishing the classification somewhere and submitting whatever necessary concepts that we need to, understanding that some of the concepts that we are using are really grouping concepts that may not be suitable for building and terminologies. But we will sort that when we get there. Next slide. So we've caught up a little bit. So our subject matter experts are 211 LA, who are the author of one of the largest national taxonomies, 211 HSAS. Find Help, who are the author of a taxonomy, a classification that is open, called Open Eligibility. We know that they collaborated very closely with our friends at the HSS work group last fall. Epic has their own classification that they've used. Unitas has a classification as well. And then 211 San Diego is with us because they are a user of all of the classifications and a 211 HSIS expert. Understanding that each of these classifications that exist, and some more than others, have been refined by user feedback over the course of decades, right? So not only are these entities expert in their own classifications and sorting, they have been refined through their own internal end user feedback loops for a very long time. Janice?
Yeah, I'm wondering if, the system I have does use Epic, but I believe for, like our community resource specialist, project that we started in 2012, and it moved into, we coordinated with Find Help or Unitas. So I think that maybe different organizations are using more than one, right?
Yeah, different organizations are using more than one, and different entities are. And we're going to be talking a little bit about classifications for different purposes and level of granularity today. So yes, absolutely. Right. And I think because we're creating our classification for the purposes of navigation and connection. That is one purpose, right? You might need different levels of granularity for outcomes evaluation or for actual establishing eligibility, right? So these are all the kinds of conversations we're having in our group. But yes, many entities use
Right.
it. Yeah.
Yeah. Thank you.
You're welcome. Right. So what we are doing now at this point, everything in bold and italics is where we are. So we are analyzed. We have all the different classifications in front of us. That's where we start. And then our next step is that we synthesize. So we try to find commonality across each of the different classifications. Along the ways, we are crafting rules for structure, and you're going to see some of those today, right? So what I'm bringing to you all are some of the patterns that we are finding as we work on our program classification synthesis. And then probably next time in 2 weeks, we'll be able to show you a little bit more of the sorting, right? So there's just a few examples of the nesting of the classification. I'm not using the word hierarchy because like a classification for the purposes of navigation and connection might have a program in multiple places. If I'm trying to help a person with one problem, I might need to have a program in 2 different places in a classification. And that's different than sometimes formal taxonomies, which have a very clear hierarchy. That all sounds incredibly nerdy, I'm sure, but it'll make sense as we go forward. And we'll see how that plays out. Next slide. One thing again, and this is different for us, it's like this is a little bit different than concept. So the name of the thing, when in our work in terminology and the terminology curation process, we really focus on names and meaning and semantics, right? And so we have evidence that grounds the purpose, like, the concept we're trying to build. And then we talk a lot about how we name it, what it feels like, is it understandable? All of the evidence we're using with classifications is about the functional structure. Like, will someone be able to navigate to and connect to services using this thing, right? And the evidence of that functional structure, again, are the subject matter experts who have been doing this work for a very long time. So what we wanted to show you again was the patterns. Next slide. Again, we do know that we are trying to aim for this open classification aligned with gravity definitions and encoding as many things as we can. And the purpose of that is that we were talking about classifications for different purposes, Janice. If we have the concepts encoded, we can organize this classification for this purpose, and it can map to other classifications for other purposes, right? And that's really critically important when we think about social care interoperability and different, even different states have different extensions of 2 and 1 HSAS, right, to allow for unique navigation to their own system and community. Janice, did you have a question? Right now, you
No,
raise your
I
hand.
was gonna put my thumb up, but I accidentally like high-fived you. Anyway, sorry. Uh,
Noted.
yeah, this
Great.
this is great. I was wondering if so you don't really, it's more like mapping than having, like you said, it's not a hierarchy. In another taxonomy I'm working in with SD out of Evidence Synthesis
Yeah,
Taxonomy
yeah.
Initiative, I'm part of that. So we have like a tree structure,
Oh,
right?
we do
That
have,
HL7 is itself, isn't it, kind of?
well, we will create a tree structure. The difference is that some of the programs
Uh-huh.
might be in multiple trees,
Yeah.
right? Yeah, so you might have a program in all kinds of different branches.
Right,
Um,
branches is what I'm saying. Yeah, it's going
yeah,
to end up
yeah,
in like the
yeah,
proteins in our DNA. Right.
yeah. And we have really, I tried to make cool pictures to help you all, so we're going to get to them shortly.
Well,
Um,
that's what we need.
next slide. All right. And then we're going to talk about structure and time because really we're just working on concepts right now. But there's a lot of opportunities for the classification is actually pretty simple so far. So it might be able to have a fairly easy publishing method and curation method because it's a lot more simple than I expected. Next slide. All right. I think this slide, yes, anyway, this is a slide that I presented for some time. It's trying to ground us in the different role of the community in the classification work than the terminology work. It's just noting that it's a different evidence, different process. Next slide. All right, just as a grounding, again, it's built for the purposes of navigation and connection to services. And Janice, yes, it has increasing levels of granularity. Under levels are organized into logical and useful groupings. And we're presenting a few different levels now. And then what we're hoping again to encode the programs eventually, if we're able. Again, some of the concepts, we only can encode things that have clear definitions. So in some of the terminology. So we're cautiously thinking about that. Next slide. All right. Okay, so this is what we presented before. Right, so the first level, and again, this even took like 4 meetings to agree on, is a basic high level, I need help with X. And you can see that these roughly correlate with essential needs, right? So are the groupings designed for their navigation and connection to services is the primary purpose of the classification? Like so even for self-navigation, Rob, because there many of these experts that we are working with employ classifications in self-navigation, like person facing, just trying to find help themselves. When it comes to analysis, there some of the high-level groupers can be helpful for tagging as well. If like an entity, like a health system, is trying to use the coded programs and the tags of the programs in Epic for their analysis. And I know definitely we don't have any of our Find Help or Unitas friends on here, but they certainly use the tags from their classifications in outcomes analysis all the time. What we're seeing is important is the level of granularity when it comes to that, and more to come. Yes, and so this is why when it comes down to resource use, the specificity might be more granular than the classification that we have. But it's found in other classifications and found in gravity. More to come on that. Robbie, of course, you're always like anticipating like my next thought. Usually. Next slide. All right. Okay, now we're going to start getting into this. This is what you saw before. And now we're going to start presenting some of the patterns. that we're working on and finding in our work. Next slide. All right, so this is a throwback. You guys should all remember, so at least those of you who are part of our terminology curation work, the way when we level set on a new domain that's like aligned with a material need, or the socially, like financially driven social insecurities, there are these dimensions that we always talk about, right? We presented them every single meeting last time with utility and security, because we use these dimensions to help us identify whether we have sufficient instruments to assess these dimensions and whether we have sufficient concepts to identify the presence of them, right? So if we think about worry and stability, that is the housing instability vital sign, right? Quantity or presence, and the correlating housing instability diagnostic concepts, right? Quality and presence can be, our homelessness screeners when it comes to housing, and then our homelessness diagnoses, and quality and safety we have very clearly in our inadequate housing concepts, and then correlating inadequate housing screeners and correlating inadequate housing concepts. Culture acceptability, we always put there because building off the work of Dr. Coates at Tufts, she correctly identifies this as a missing dimension that's not sufficiently represented in many instruments and many approaches to screening. But we always carry these things forward. All of these concepts are part of our food insecurity work. They're all part of our utility insecurity work. They're all part of our transportation insecurity work, right? So, and we use these again to analyze sufficiency of instruments to see if there's gaps in our sets and to build diagnostic concepts. I hope you're all refreshed, right? Because this is again, what we do. Deeply nerdy, in the realm of psychometrics and assessment, building and measuring dimensions. The interesting thing, maybe not interesting or surprising, is these dimensions have started to come to light in our classification organization. And it kind of makes sense. And I'll show you why. Next slide. So as we work through our top level concepts, and you saw them all, like food, housing, transportation, those were all the top level needs. And then when we started to build out the secondary concepts, we noticed this pattern, right? That really build off of those dimensions. So you have your primary need, and you have programs to stabilize the need, programs to acquire it if you don't have it, and programs to improve the safety or quality of that need, right? So with food, you branch out to programs that help pay for food. Again, this is the theme that we saw across all the classifications. So when we start to knit it together, this is where we start to find the consensus. So with food, you have programs to help pay for food, receiving food, which includes emergency food, but also not emergency food. So things like medically tailored meals would be in here because it's actually receiving food, as well as, food pantries. And then programs to educate about the quality of food, right? Goes along with transportation, programs to help pay for rides, programs to acquire rides, programs to help with the maintenance of rides. And this all mirrors the structure and sorting of all of these different classifications on housing is the same thing. Programs to help pay for monthly housing costs, programs to find shelter, and programs to help fix or weatherize your home. Does this make sense? So it probably seems very, very simple, but it took a long time to get to. Right. So our classification is starting to be sorted across these different things, right? As we knit together systems thinking with all these different classifications, these are the secondary level patterns we're seeing. Yes, Janice? Hi.
This is kind of wonky and I don't fully understand it, but we just voted on the SD framework for all of you that might know about the evidence synthesis taxonomy initiative that's global. And we were going to go hierarchical and they changed to tree. It had something to do with the term facet. So it might be different here. I just wanted to, I like the term facet, but somehow it didn't fly with the tree. So I just wanted to comment on that.
Yeah, so facet, I might have just used dimension because that's what I use in the other slide. But
Yeah,
here
I'm not just, I don't know why or anything. I thought it was weird, but yeah, I don't understand why, but he actually gave that to me as the reason why we're not using the hierarchical. And I'm like, okay, whatever.
Great. Now I have something I can do a nerdy deep dive on after this call.
Good luck. Anyway, you can write to
But
Zach
Sharon
and
is
he
still
can tell
he
you
spends
more.
her evenings researching. I'm
Yeah.
not joking. Yeah. Thank you so much, Janice. Yeah. So this is the pattern we're seeing, and then first of all, just like gut check. I know it might look really very simple, but does this make sense, right? So like if I was a person and trying to self-navigate, or if I were a coordinator or a community health worker and trying to help someone, I would feel like see the person, understand what their need was, right? You have no food, or I need to connect you to home delivered meals, or you're really looking for help paying for food at the grocery store. I'm gonna connect you to SNAP, right? Or you really want to understand how to, either, eat aligned with your diabetes, diagnosis, or, try to just eat better in general, right? This seems to make it seems like you all are with us. So is there a relationship between how each of the service levels are linked together for an individual? That's help me understand that brilliant question. What does that mean? What
Oh
do you
yeah, thank
Hi.
you. Yeah, I'm just curious. My name's Suzanne. I'm a dietitian and
Oh,
do
love it.
work with patients on food and nutrition security. Yeah, I'm just kind of one thing that I feel like comes up quite a bit is that, especially in healthcare, with our episodic
Mhm.
interactions with patients, that of course, there's a lot that happens in between those visits, in between those healthcare point of care, and including when patients receive a resource, how they're using it, and then how we link together the different aspects of service here. For example, if we are providing someone a particular level of programming, maybe it's connection to SNAP
Yeah,
benefits, and then maybe they also receive a medically tailored grocery package.
yeah, yeah.
How this a taxonomy, how the classification kind of identifies that those pathways, in that some may not all exist at the same time, and some may be naturally linked together as an intervention. And so showing the kind of intensity, duration, that kind of approach.
Yeah, so that is important and amazing and actually really ties in closely to our enrollment conversations. Um, because this is so high level. First of all, I love that you're here, and I hope maybe you came for Coding for Food, but regardless, it's very, very, very soon. And I just love nutritionists. So hi, welcome. Um, so that is not the purpose of this classification. So those interrelationships won't necessarily be part of this. And one thing of note is that it's so high level, the classification, that we are needing to step back from insecurities as well sometimes. Like you'll see, and we'll see how it goes. But the interrelationship of those of programs and the glide path between, we often talk, the dimensions are almost like a scale, like a pure scale. Like you move from not having into stable into worry, right? It's just like the USDA food security module. The bottom is the worst, right? It's not the same thing that we're finding with the classifications, but there's more to come there. Did that make sense, Suzanne? I hope.
Yeah, I think that's a good call. Thank you for reminding me that the intent of this is the navigation
Correct.
um,
Yeah.
point. Yeah, okay, that's great. And thank you for the call out for dietitians. Happy to be here.
Yeah, you'll find yourselves in here in the help for educating about nutrition. Any other things in the chat for healthy? Oh, hi, Wanda. So for healthy food boxes, there are linkage to how to prepare healthy meals. Okay, so this will or a lot of the specific program conversations, like the healthy food boxes is very aligned with the medically supported groceries conversation. We're going to be diving deep into that in the coding for food work. And I think it'll be in just 2 weeks, right? So
Thank you.
yes, of course, more coming there. And I know you're here because that work was supposed to kick off, but our SMEs are starting to meet, and we'll get back to that really, really quickly. And it'll be a whole half of this meeting very shortly. All right, so this was the high level stuff. So now we're going to get into the next meeting, and you can see I don't think we're definitely waiting for some of our other our even Katie and Kristen, our coding for food folks, aren't here yet, but they'll be here next week in 2 weeks. Next slide. I'm going to go down into some other levels now. So this is the pattern of granularity also that we're seeing. So that was the kind of aligning with the dimensions, right? So you have stabilizing, acquiring, and quality elements. So we're seeing that pattern across all the different material concepts, across all the different the high level food transportation elements. So the interesting thing as well, and Janice, this goes back to what you were saying, and Rob, it goes to what you were saying regarding purposes. So there's also a very clear pattern of granularity that we're seeing across the classification that that is in common from Unite Us and Find Help and Epic, and the classifications that one of our 2-in-1 HSAS have in the community, and gravity kind of sits right in the middle, which is really interesting. Right, so we have the classifications that have been built for the purposes of navigation and connection to services. And that is not the only purpose of the 2-in-1 HSAS taxonomy. Then you have gravity programs that have been defined to be distinct and measurable and aligned with outcomes, Rob, right? Because we want to specifically talk about the Older Adult American Act, farmers market voucher program, right? Because everything that's a distinct program, for the purposes of analysis and connection, I have to give a person a specific thing, right? And then we'll see that 2-in-1 is even more granular than that. So there's more coming there. Next slide. All right. And thanks everybody for your patience as we created weekly meeting on program and every other week on program enhancements, and coding for food is coming shortly. So this is what we're seeing as we start to think about the granularity element, right? So you have that primary need, which is food, for example, just speaking for the nutritionists in the room and the former farmer, Sarah. That's the example I'm going to use right now. You have the facet or dimension, Janice, of that need, programs to stabilize it, programs to acquire it if you don't have it, or programs to improve the quality or safety of that. And then we're seeing this pattern of these program type groupers that are next, right? So within programs to stabilize it, there's some grouping concepts, right? That are very, very similar across Find Help, Unite Us, and Epic. And we have one, again, Matt, you're on the call. You're the only person who's just me here. But this new meeting cadence might be a little tricky for folks. So then we have that level, that grouper is used consistently across Find Help and Unite Us and other, and Epic for tagging, right? And for analyzing with internal data analysis. And then gravity is next. So what we're finding is gravity's programs are a little bit more specific. And then even more specific, or when we start adding specific features or conditions so either facets of a population or conditions that create a specific program type, like halal food box, right? Or, or housing for individuals with HIV/AIDS, right? So what we're seeing is there's another level of granularity that is not gravity specific, like we didn't drill down to that yet, but is represented in alternate classifications, right?
Unhoused and diabetics and things like that.
Yeah, or like, trans-friendly housing, right?
Right.
Like there's and that identification is super, super important when you're trying to connect people to things, right? If I'm trying to get down to that level, it's really, really important. But
It
most
actually can have legal complications too, to be honest. We tried to start the LGBT elder housing here like 10 years ago, and that was how we initially were able to add a lot more groups, Latinos, Muslims, other housing. But originally it had to be, it's still open to everybody, but there's a focus. So when you're getting federal money, it's interesting, some of that, how the money goes. You still have to offer it to other people, but it might have a primary focus.
Correct. And then, how gravity and many of the classifications solve that is with what you would imagine would be like a tag on a program. It's like almost like for those of us who are clinicians, it's like a qualifier, right? So I have X program with these qualifiers. On which of the 3 access programs dimensions is going from food? See, Corey, now you're asking what dear Wanda just asked. No, what Suzanne just asked. So because this classification is built for the purposes of navigation and connection, the linear scale of food security to food insecurity is not as easily represented. But you can imagine programs to stabilize it and programs to improve the quality or safety of it are a representation possibly of a more stable status than if you have none in the middle, right? But the problem is acquiring the need is also, it gets super granular, but if you acquiring the need is also where you're getting like medical, like a produce prescription, which might not mean that you're food insecure. Corey, did I answer your question? You're literally asking the same thing.
Well, I think so. I mean, I think if I'm thinking if I'm navigating, if I'm looking, I don't have enough food. I worry about food.
Yeah.
And I'm looking to navigate, and I'm looking to, I mean, for example,
Yeah.
if I don't have enough food, or I'm worried about food, and I'm going to kind of search to navigate.
Yeah.
And, you know, I'm thinking about which of those 3 dimensions do I go down? How do I choose? You know, from my perspective, I want to not worry about food. And I guess, you know, how do I know which, just from a navigation perspective, and maybe if this isn't the right question or right time to ask this question, we can.
You should go to the next slide. I think I'm going to help you out here. Actually, go to the next one. Okay. Sorry, this is very tiny, but Corey. It's important to note that the programs to help pay for food and receiving food and emergency food, those are just placeholders, but we don't know if they're actually going to be visible, right? What you will see are groupings of financial assistance for food, government food benefits, community gardens and gardens programs, food pantries. So this is this program type level here, that middle level, Corey, right? And that's the program type level is the only thing that's constant across and similar across all the different classifications. And that's where most of the SMEs classifications, except for 211 stop, right? Is that program type level, right? So if I wanted food, I don't know, I think the jury's out whether we even build these programs to help pay for food or receiving food or educate about quality of food concepts. You can help us figure out if they're necessary. What you will see are a set of things like these bubbles in the program type level. But when each of those but if you look at how the middle community gardens, food pantries turn into gravity programs, gravity's granularity is much, much greater, right? Than and on both of them, because we have every single specific program detailed. And then in 211, it would be even more, right? So Corey, what we're thinking, and we can all integrate on this, but when you look at any of the open eligibility or Reunite Us, you actually don't see programs to help pay or receiving food or educate about food. All you see is this list that you see right there in the program type side. Does that make sense?
I just added something in the chat that might help too, Corey. So I've seen, I lived with 8 women, and one woman, you know, she was food insecure, and she only got $15 a month food stamps.
Yeah.
Another housemate got 200, right? And so it has to do with, you might have medical expenses, you might, you know, it's all how much you make a month, depending on what you get. So to just refer somebody to SNAP might not be enough in a lot. And I have seen that more people are reticent to apply for SNAP than they are to go to a local food pantry. It's available just because of the paperwork. But the bottom line is a lot of people are surprised when they find out how much they actually receive. So
yeah, I have families that only get like $5 or less with food
right.
stamps. Right.
Uh-huh. Yeah. But you'll get it every month.
we fought for a long time to get them food stamps, and then their monthly award was $1. And
exactly.
they're like that. I know. But so Corey, does that make sense? So what a person would see is likely only in the program type, and then they could choose their own adventure, or the navigator would help them do that. Right?
Yeah, okay, thank you. And I'm still learning. I think is if I, I just try to imagine someone navigating this stuff, and I don't know what I would choose from here. I don't know what would be best. Maybe that's where the navigator kind of comes in to help decide
Yeah.
what's the best fit for an individual.
We have there's a whole slide just on navigation because of housing. Hamali, did you have something you wanted to say?
Yeah. So Corey, the question that you asked, how would I know that patient went from food insecurity to food security? And that was the goal that we want to accomplish. So basically the way and this was the question I had from the very beginning when I joined Gravity. So patient diagnosed with food insecurity, and the goal is to become food secure. But when we are navigating through these hierarchies, that we don't know when and how that goal will be accomplished. But there would be multiple sub goals, like patient is food insecure today, and does he have enough of navigation to be food secure for that particular day? But that doesn't mean that he is completely food secure. So food security would be maybe a very long-term goal, but the navigation is only to get that person there, and these are the steps in between, right? So I don't think and so there was a different diagram, Sarah, where we have diagnosis, then we have a goal of food security, and then the interventions. These are all interventions to make the patient food secure, and then at certain point, maybe once the patient is food secure, then we go back to the outcome, which would be the goal accomplished. These are just the steps to help him get food secure. Would that food security be a permanent, or are we just accomplishing the sub goals of food security for a certain period of time? I personally don't feel like I don't think that this will tell that patient is food secure on any of these axes, but these are just the interventions to assist patient become food secure.
I think it's hard to take that. Thank you, Somali. I think it's hard to take that purpose out of our heads because we talk about it so much in the terminology development meeting. But this is just to navigate and connect, right? So, but I think if there's questions regarding the usefulness of the program type level, that's really important. But the interesting thing is that this is very much in common across all of these different navigations that we've analyzed at this highest level, and they've been working in self-navigation and connection or navigator-assisted navigation for some time. There's the interesting thing is how similar they all are, which is helpful. And the interesting thing on this slide to me, in addition to that, is that Gravity's granularity is higher than they have built to, most of them, but it's less granular than we see in some of the community social care classifications like 211 HSAS. Right, so we're somewhere in the middle. Does that make sense? I hope so. So if we go back a slide, again, so we're talking about patterns, right? So one pattern is that we have this facet of the dimension of the primary need in program sorting in that. And the other is that we have what is common across all the classifications is this program type level that Gravity doesn't usually have, right? And sometimes we have an exact match for that, but sometimes we don't. But this is it's like a grouper concept. And then what Gravity is in program subtypes. And then where 211, HSS, and other taxonomies come in is in the specific program. So if we go forward one, I wanted to get to transportation and show. So this is, again, an example of how it plays out with transportation, which is a little bit more concrete, I think. So programs to pay for rides, you have gas assistance and financial assistance for transportation. Those are two pretty tangible high-level groupers. And then underneath that in Gravity, we have all of our different voucher programs that we use. So we have taxi vouchers, public transportation vouchers, and gas vouchers, right? And then you have the acquiring. And so the program type classification is rides and taxis, including rideshare and paratransit, NEMT, and whether we actually say that in this level is to be determined, and vehicle loans and financing, and then vehicle repair. And you can see again that gravity, again, everything in the gravity element is a currently defined gravity concept, which has a definition. And again, the reason why we drill down is because those are all the things that people are analyzing when it comes to outcome analysis. Like it's like, did the rideshare program help the person? Were they less like, insecure? Right. And so you have does that make sense? Hi, Janice.
I would also advise in the program subtype level, they might have it either in the classification and or at our level, but is the modification of vehicles for individuals with disabilities, right?
Yeah.
Mm.
So we should, so gravity, can we just call out that would be, so Sarah Bahal Hamali, we're going to do an audit and make sure that we have that in our transportation list. Thank you.
Yeah.
I'm just saying that out loud because I'm a little sick and I probably won't remember. Usually I have in mind like a steel trap, but probably not today. Rosie?
That I agree with Janice, because that is probably one of the better programs across the country, because it's federally funded, that many of those programs about transportation modification of vehicles. And so that, like every state has some type of program. Some states are better than others, but they do have types of programs for modification of not only transportation, but also housing.
Yeah, and we have the modification of housing in our housing quality list. Absolutely, yes. All right, so this is our first attempt. So last time we came together, we only had the high level concepts. We've been working really hard in this program type classification. So that's where we've been. That's where the classification work really sits, is everything in bold under program type, because that is the synthesis of all the different existing classifications that's there. And sometimes most of our work is trying to find the common concept across all the different classifications and deciding whether things are program type or they go down into the gravity level. So eventually we'll have something filled out where we have all of the different concepts and then all of the different program types for the purposes of the classification. Okay. Again, I hope this is very different than what we do in terminology. And so our normal domain development, because we're trying to figure out how to sort things and knit things together across different classifications. But thanks for your patience as we do this new work. And then next slide, we're going to go we're going to try to go, we skip food's next, right? All right, and then next slide. We just wanted to note that right now what we're working on really heavily is the need of housing, and it's proving to be incredibly complex. And it just actually made us realize how critical housing navigation is, and how most entities, most community-based organizations or community action agencies, or even Find Help or Unite Us, or have specific housing navigation experts because of the complexity of accessing services across HUD and other. And so because eligibility and access are complicated, and there's many different types of housing programs and intricate eligibility requirements, we also note that makes the whole classification complicated. But also we just want to note that even if you are eligible for something such as a Section 8 housing voucher, sometimes long wait times make that access unlikely. One of our SMEs, Elena, was talking about how there's a 13-year wait list for Section 8 housing vouchers in her county. 13 years is not really tenable, right? So just noting that housing is taking a fair bit of time. So this is, I thought, I'm Corey, I am going to address in this call. So I just try to think about how does that, yeah, so this is when, Corey, I want to state that this is what happens with community health workers and navigators. That's the work that they do, right? And when we think about like our community-based organizations talking about the refer for further assessment, right? you know, or the benefit of calling a 211 and talking to the 211 about yourself and your needs and having them connect you to an ideal program. Right. So there's self-navigation, which is fantastic, but and we'll try as best as possible to build a classification that allows that. And certainly the classifications that are in existence do that. However, assisted navigation is really the dream, right? Like I think about even the complexity of navigating programs that a person's eligible for in my FQHC, right? I have a person for that. Her name is Susie. And I say, Susie, help me. And it's actually not that much different than like eligibility for different medications. Like we know this, the complexity of eligibility really well. But this is why, and you know, there's experts in using these classifications as well, right? So one of the primary users of these classifications are people and helpers who are trying to connect people to services, right? And that's part of what's shaped the classifications, like whether it be a care navigator in a clinical setting or a community health worker or a navigator who's existing in a community-based setting. So Rob, they directly align. So if we go back one slide, so Corey's asking a question, Rob's asking, so actually, can we go to like I'm so sorry, Hamal, you're being very patient with me. So if we stay here for a second, right? Actually, go to the food one because it's the better example. So sorry. And Rob, I'm going to try to lean into your question. So when I talk about 211 HSIS, I talk about that's because they're helping us, right? So the classification organization that we see in our Find Helps and Unitises and Epics usually is in the program type level. There's a little bit more granularity in some of them, but this program type level classification is common across each of their work, right? Gravity specifies, again, we didn't delve a classification, but our program specification is in the subtype level, right? Where we built specific programs that have specific definitions. So not a program type grouper, we're here, right? When it comes to 211, that's why I had a whole slide for it. Yeah, Molly, you're doing the best job with those arrows. I love you. So that's when we start to see the granularity of 211 HSIS go so much deeper, right? Because you can drill down to like the differentiation between a food backpack and a food bag, and like, you know, it's incredibly detailed because of the different types of services that have been delivered in community-based organizations for a very, very long time. More detailed than I could ever support in a submission to SNOMED, right? But detailed in a way that helps connect people to services. Right. So the way all of them are helping, right? 211 is at the table, Find Help's at the table, Epic's at the table, United is at the table, 211 San Diego's at the table. We're all working on this together. And where we see ourselves is there's the common program type classification. There's gravity here in the subtypes, which will eventually nest into the higher level program type classifications. And then there's 211, which will eventually, hopefully with all of our program concepts that we built in terminology, I can have direct maps from a gravity concept to a 211 concept that rolls up into a program type concept. And even in the program type concepts, 211 HSI has them as well. And in the highest level needs concept, that's part of an open taxonomy that 211s use and United Ways use worldwide. So Rob, that synthesis is all here. I don't know if that was a good answer, but each of these groupings are directly representative of the knowledge of all of our SMEs. So program types, really the Find Help, Unite Us, Epic level, right? And then there's a little bit more granularity in some of them. Program subtypes, gravity. And then 211 has lots of the terms in the gravity level as well, and has the program type classifications as high level groupers, but then goes to a level of granularity that that gravity does not.
Can I just ask some more questions there, if you don't mind?
Yeah, go for it.
So first, in your diagram or in your slide, the bolded items versus the non-bolded items, what does that represent?
That's like a parent concept, and I did that to help our explain how gravity nested, right? So if you think about and it's also bold when it's a direct map. My apologies, I should have unbolded those, but I was doing this for the purposes of the SMEs this morning. Like infant formula is an almost exact match with one of the groupers there, right? But like all of the meals programs we have are in meals, right? So you think congregate meals, community meals, like school lunches, school breakfast. Those all go in over meals here. So I was trying to show the difference, just to use bolds and non-bolds to show how our programs nested up into the program types. But also bolds mean when there's a parent concept, like food pantry is a parent concept. FDIPR is a type of food pantry specific to Indian reservations, to Native American reservations, right? So, and then home delivered meals is a parent concept of which meals on wheels and medically tailored meals are a subtype. Does that make sense? Again, the bolds I should
Kinda.
have
So,
yeah.
but yeah, and I don't want to get too far into the weeds, but just on this one type. So you would propose that there would be a program type level of food pantry, but then a program subtype level also named food pantry that is a different idea, but is just represented by the string food pantry.
That is the direction we're heading to, because food pantry is both a grouper and even in gravity, it's a parent concept and a child, and both are relevant.
Yeah. So just as an aside, we ought to talk about distinguishing those beyond the conceptual group.
Yes.
You know, because what that does is it means that the meaning of this concept can't be understood standalone. It has to be understood in a context of its place. That's, you know, it's not uncommon, but it's a dangerous thing. So I'll just say that, and then we can move on.
Can't wait to talk to you about that.
What's that?
I can't wait to talk to you about that. That sounds
Yeah. Okay. And so the other thing that I was just, I mean, I don't want to kind of get into, again, the mud here, but so I sense that by this, you know, the alignment that's occurring between what happens with 211, and I also was just playing with Find Help, and there are over 2,000 things that were available to me in my zip code, and looking at the way that gets subtyped, and the subtyping, which is great, because then you get to a place as a user that gives you a range of things that might, you know, it's wonderful because number one, you may have something in your mind, you go, oh, but I could actually use that, and I didn't have that thing in my mind. So that's a really powerful value of this kind of navigational process of identifying and collecting things. But that presumably, when I'm looking at Find Help, I'm looking at Find Help's taxonomy. And so what we're doing is we're building a very aligned taxonomy, I believe. And in doing that, are you proposing that these things that we see on the screen would then be submitted to a code system? And you mentioned SNOMED. So is that the plan, that we would build out these things, identify these concepts, and then with the expectation that universally easily available, those things would then be promoted to, I'll pick one, SNOMED, and then they would appear there. And the idea is that if someone is using one of these other systems, they would map. Is that what we're thinking of doing?
Yeah, you heard me be a little cautious about that earlier, because we know very clearly.
I'm trying to be cautious too, but I'm trying to be direct in asking that question.
So everything in the gravity subtype already exists in SNOMED, right? So everything, because it's part of our intervention structure. So we already have definitions that SNOMED has approved, but you know what it's like to build with SNOMED. You need a name and a national reference, and it, like, they're,
Yep.
you know, our friends are very strict. So I don't know, and I doubt whether the program type level concepts will be able to be built, because they're groupers, right? And we'll see. I have, you know, more to come here, but I think the question we have to ask ourselves, and the question, you know, that we are talking about in our SME meetings, is what level of tagging is really critical, right? So, like, we
What
know
level of what? What was the word you used?
of like tagging and mapping,
Tagging. Okay.
right?
Yeah.
And so if we already have all, like, I'm, you know, It won't, again, we have to be careful too, because what we build in SNOMED is bound to SNOMED's taxonomy. And Monique, I'm channeling you. If you're on the call, I haven't seen you yet today. But if you're here with me, I want to fully note that if we build in SNOMED, it will not resemble the classification that we have here. It will be a SNOMED classification within their taxonomy.
And I didn't mean to kind of lead you.
No,
You
no.
mentioned SNOMED. I would be perfectly happy for you to have said, well, what we're going to start with is a gravity terminology. And then if we decide that needs to be in SNOMED, so be it. But because I certainly, I mean, we've been, gravity's been doing, I say we, because I'm now part of it, but I'm not claiming any knowledge. But so gravity's been doing a lot of work where they build, their own terminology with the expectation that people who buy into gravity and then implement it would utilize that terminology. If they need to actually map to another code system, so be it. And so it makes sense to me that we would be making these things without concern with regards to whether they be submitted subsequently to SNOMED or anybody else, but the expectation they're just used in gravity.
We do that though, Rob. I think we only build directly into terminologies, into known interoperable terminologies, right?
But gravity is, well, I want to say, if it's not already, it certainly could be publishing. I mean, when I say gravity, I mean HL7.
Okay,
So
okay,
through gravity.
That was one of the options. Yes, that one of the publication structures was, yes, I hear what you're saying. Yes.
So in this work that we're doing, we do this with our SMEs. Okay, there you go. So then the plan is, then you can now, Molly, go all the way back to where you were. So the plan is to create all of this in the context of our work with our SMEs, knowing that we're getting input and alignment with these existing hierarchies, these existing taxonomies. And then these will be gravity things, and we will publish them as an HL7. I mean, I hear that you're not decided yet. We are not decided yet, but that is definitely the path of least resistance. Yes. And it's useful. So it's not like it's a second class choice. It's a first class choice.
Correct.
So, okay. So I kind of get it.
But I do want to say though, our friends in the 211 HSIS ecosystem, they just want to be able to map to something specific, right? So they really want a code. They want some, or they want some they want something representable, because they do so many different, they do such work with social care, healthcare interoperability, and it's the same thing. So we'll see, more to come.
Okay.
Yes. Thanks, Rob. And Hamali, thanks for the extra navigation. You're doing a great job. Because I definitely am like half-mast today because I'm sick, and I swear I feel like you all are helping me along here. Okay, so I'm going to quickly go to okay, we've talked about the patterns right now. So now you understand this is really the knitting together of all of this knowledge, right? And again, in our SME group, we are lucky to have 211 and Epic and Find Help and Unite Us and 211 San Diego. And it's amazing that we're all collaborating on this. It's such an honor sitting with all these smart people who are doing something that's totally new to me. And so I just want to quickly, so this is again, the patterns we're seeing, and then how we publish it to be determined, Rob. More to come, but there are easy paths, correct? And then but we have to make sure that they meet everybody's needs, and we'll go from there. And I want to note that before we even kicked off, I did Sarah's tour of people who had ideas about how to publish it, right? So I sat with Dan Freeman, I sat with Carmela Kuderk, and I sat with all of these different folk just saying, like, how would you publish an open classification? And all of those ideas, and Anish Chopra, I sat with him too, and he's like, publish it in schema. So we'll see what comes. But we're just in the sorting and organizing phase right now. Next slide. Okay, I think we're almost ready to close. Next slide. Again, I just wanted to note, and I said this earlier, that one of the things that's been really beneficial to Gravity is to get a different view on our program list. And I already mentioned that we were going to be doing this in the program analysis with all of you, having end users look at our programs and make sure that they're sufficient. But simply sitting and with experts in classification has us realizing the gaps as well. So gaps in roles and gaps in programs that we're seeing as we do the sort. And we were talking this morning, it's like a prism, like you look at it a different way and you see gaps and holes, right? And so we have some navigator roles in our class, in our system, like we have a digital navigator. We don't have housing navigator or benefits navigator, right? So more to come on that. Like it seems specifically, you know, I actually just presented to NUCC yesterday because they asked Gravity to come and talk about lots of things, but one of them was on roles because of the request for information on the roles that are implementing the new calendar year 24 HCPC concepts. And navigation was one of those things that we noted is a possibility. So we're identifying gaps in roles and gaps in programs, and we'll bring all those back into our consensus process, right? So once we, you know, so Molly and Sarah can testify, I was dropping references for programs into Slack as we were working this morning so that we could, you know, ensure that they're built into our terminology going forward in our value sets. Next slide. I think we're there. Okay. We've had a lot here. I thought it was going to be a short meeting. That's always I never should say that. I should know by now. Monique always cautions me when I say that because she knows it's never true. Thank you all. Okay, so any questions on what we've talked about? So today we presented, last time we were together in the classification, all we presented were the high level needs. What we wanted to do today was come back with the pattern that we're seeing on sorting into those second level, you know, like program type tags, which are really the heart of the classification. There's a little caveat on housing because housing is really, really complex. Thank you, Janice. But we also talked a little bit about the levels of granularity, right? So the classifications that are in common across Epic and Nice and Find Help are one level. Gravity sits a little bit deeper because we have to define each specific program, and then 2-in-1 goes even further and encapsulates everything up to the top. Any other questions, friends? Thanks for being with us today. Our first fall program enhancements call, again, Coding for Food will merge into this meeting, I'm hoping, in 2 weeks.